There it
There
is.
it is.
We're back. Welcome back to another episode of the Demand Better Podcast, your ultimate consumer's guide in the health, fitness, and wellness space. We are sponsored by Fit Care Physiotherapy and Wellness, with the emphasis to focus on your fitness so you can avoid the healthcare space. I'm your host, Corona, coming to you from the concrete jungle of New York City. And joining me, as always, my esteemed co-host, Dr. Bo Babenko, who's in Colorado. What's up, Doc?
Living the dream. Just living the dream. Figured we'd get a parenting expert on here, men's health and parenting expert. I got the toddler. Toddler's taken up all of my time, energy, and money. So why not get someone to help me do it better, the parenting thing.
So this is really all about you. It's terrible. Absolutely terrible. Now that summer has ended and the Man Better Podcast returns with a true champion for men's health and fatherhood, Armin Brott. Armin has worn many hats in his career: Marine Corps veteran, author, columnist, even media regular on shows like The Today Show and CNN. But his biggest impact has been changing how we view dads. Now you're tackling another crucial challenge: men's health. Let's dive into why men's health needs a champion and what we all can do to make a change. Armin, welcome to the show.
Well, my pleasure. I hardly recognize myself there. It was you almost had me as a Marine Corps general, which would have been a big surprise to a lot of people.
Veteran, my friend.
Much
Thank
better.
you for your service.
Glad to be here. Thanks for having me.
Well, listen, man, we're getting in. Obviously, Bo's a father. I'm going to let him pretty much run because this is kind of like I'm childless. I'm like a cat lady. I'm childless. So talk to me. We can start off. Let's start off with the men's health.
Okay.
Because
that applies to you, David. That I believe.
I'm old.
The last I
I'm
checked,
old.
and you're a man, from what I recall.
Yes, I am. But this is a topic. Me being in my 50s, this is a topic in which my generation of people, it was like, suck it up, man. Put on your big boy pants and you do what you got to do.
Exactly.
And you know what? And if you're struggling mentally, you're on your own.
And
so what made you get into?
I've heard Armin talk about that from the beginning too. It used to be the big boys don't cry, right?
Yes.
And that just it sets the tone from childhood. So just to add a little, I'm sure he can talk about this. I'm just kind of stealing his own thunder here, but the men's life expectancies have diminished compared to women's. I believe the gap is now. It's dropped by 5 years, but I believe the gap between men and women is now 7 or 8 years on average in America.
That's 6. Yep.
6. There you go.
Yep.
So you're the expert. I'll swing it back to you.
Well, I can just give you some of the basics. So I think that's one of the biggest ones, and that's one of the one that really annoys me most of all when I hear a lot of the women's health initiatives. Is Biden and Obama did this, is they really focused on women's health, and I say, wait, hold on just a second. You've got guys who are dying 6 years younger than women. How is that not a national health emergency? And men die in greater numbers at younger ages of 9 out of the top 10 causes of death. The only one being Alzheimer's, where women exceed men. And men, for guys in their 50s in particular, something to really listen to. Men have a tendency to show up at the doctor's office years later than women do. And so by the time they get there, for diabetes, for example, it's about 15 years later. By the time you get there, it's practically incurable. Can't even deal with it. I mean, Bo, you're a physical therapist. I mean, somebody comes early on with an injury as opposed to having continued to walk on it for 15 years. Your prognosis of getting somebody to walk without a limp is much different. And so those are really, really big things. But the biggest issue for us, anyway, and started this new nonprofit a couple of years ago called Healthy Men, Inc., is really looking at the healthcare system and saying, what is it about the healthcare system itself that is keeping guys from showing up? Because we're about half as likely as women to show up in a doctor's office for anything. And so one of the things that keeps us out of there is that the system itself isn't welcoming. It doesn't make us feel like we belong there. You go into a doctor's office and there's a lot of women's magazines and the walls are pink or purple and it just doesn't feel like a masculine thing. Or, we have jobs and they say, well, you can come in at an appointment at 2:00 in the afternoon. Well, if I work, I can't. How about if you have weekend visits or that type of thing? Or just doctors who are not educated about men's health enough to ask the right questions or to propose the right screening tests that men should have at various points in their lives. And so that's one of the big obstacles, is looking at the system itself and what we can do to get guys physically engaged, mentally engaged in it, so that they actually show up when they're supposed to show up and take better care of themselves.
Yeah, it's a struggle. I mean, it's definitely a struggle, especially at our age, at least my age. Speaking for myself, because Bo's in his 30s, loser.
40.
But,
I just turned 40.
I was there a long time ago. Where I am at right now, like I'm, according to, like, we do a CEO series also with men.
Mm-hmm.
These guys are normally in their 50s and 60s, and what you find out is that a lot of these guys themselves, bust their rear ends at their job to be successful, and then what ends up happening is they become sick and they take all that money they've earned, they've had to put it into their healthcare because they've been waiting. What do you like? I look at men's health and I look, you got to take care of yourself. And you got to take care of your most important asset. That's the way I look at it. What are for guys? I think we should start earlier. First of all, that's what number one.
Absolutely. Yeah.
But from where we are right now, let's deal. Can we go from where we are now in terms of my generation, in terms of that, and work our way back? Because I think it's easier to come from a 25-year-old that goes regularly to the doctor than it is for someone who's in his 50s.
Well, the 25-year-olds, first of all, don't go regularly to the doctor. Right. Most guys drop out from about the age of 17 or 18 when they stop seeing a pediatrician. The next time they see a doctor is when they have erection problems or they had an injury. So women have a tendency, or girls, they go from seeing the pediatrician to seeing an OBGYN as their primary care physician. And so they're getting some continuity of care all the way through. But guys often have a 20, 30-year gap between seeing a doctor. And even after they start seeing a doctor again, they should have regular physicals every year or every other year, depending on what age group you're in. They tend not to do those things. So yes, you should do it. But I'll tell you, one of the things that I found most successful in the guys that I work with, and just working in the men's health field and talking to a lot of people, is playing into the provider protector thing that so many of us have, and saying, you want to be a hero, you don't want to go to the doctor, you want to be a tough guy, okay, don't. But you know what? Your wife, your girlfriend, your partner, your kids kind of like you to be alive. So why don't you get your head out of your butt and start taking care of yourself? So it's really not. I mean, you were saying this, Corona, about we need to take better care of ourselves when we start young. Sometimes it's really doing what we do almost instinctively, which is caring for everybody else around us more than ourselves. So you end up kind of coming at it sideways, doing it for them instead of doing it for yourself. Either way, our goal is the same, which is to get the guy to do it himself eventually. And I when I first started off with this stuff, when I first started off writing about the topic, I thought, yeah, my kids are going to grow up in a completely different world, and moms and dads would be pretty much the same. I started working in men's health, and I thought, sure, in a couple of years we'll fix this stuff. Well, I've come to the conclusion that it's not going to happen in my generation, and maybe Bo's generation will happen, but maybe his kids will grow up in the generation where moms and dads are looked at with equal fondness and respect, and where men naturally take care of themselves instead of having to have other people worry about them and do it for them.
Armin, I just want to point out your audio is going a little in and out. Not sure. That's okay. Not sure what's going on there, but just apologizing if any of that was not clear for listeners.
It's good information too.
It's really good information. I think we caught most of it. Hopefully we can clean that up moving forward. But yeah, I guess following up to that, I think, there's the Blue Zones. I think most folks might be familiar with it, a recent Netflix series, where we're looking at what's helping people live longer, and looking at cultures where folks are living into the hundreds. And again, that concept of purpose, whereas again, in American society, we'll keep using that since that's where we're all located here. There's the get successful, make your money, save up some money, and then boom, now you can play golf after you're 65. Or whatever that age is.
Boring.
Not for Corona.
But one of the things I did a book years ago called Father for Life, which was looking at the whole arc of fatherhood from taking care of infants until you're kind of being taken care of by your own kids, and found some fascinating research done in the 20s and 30s where they looked at life expectancy of
The 1920s and 1930s.
Oh, yes, exactly. Wait, I have to think about this. I'm very much a 20th century person. Yes, the 1920s,
Okay, just to be clear.
1930s.
And your audio sounds
Awful.
excellent now, by the way. Whatever you just
Okay,
did.
I'm paying very close attention to it. So, but what they were finding was that looking at letters that soldiers wrote home from the war, and finding out that guys who felt that they had something to live for, that they wanted to get back to their families and their kids and their parents and their communities, when they have a purpose, they take better care of themselves. They were more likely to stay out of dangerous situations. And I found this in my work with fathers is quite often when a baby shows up, all of a sudden you start thinking about things in different terms. You say, I smoke, but now I see my kid walking around the house with a crayon in his mouth, pretending to smoke the thing. And I'm gonna change stuff. And I remember for myself in the middle of an intersection that I had just gone through on what I told the cop was a yellow light, but he told me it was a red light. It was. I remember thinking to myself in the middle of that intersection, I can't drive like a moron anymore. I have people that I got little kids at home. I got to take better care of myself. And so there are some things that change your thinking. But we still need that comes from internally, but there's some stuff that really needs to change externally as well. And we need to get the support of our communities, of the government. We need to have more public service announcements talking about the importance of fatherhood and the importance of men's health, too, because it's, as Bo mentioned in our previous conversation, that the rising tide lifts all boats kind of a thing, that when men are healthier, their wives and kids and partners are healthier, and we have healthier communities as well.
And I want to
the government gets more tax money too because we're around longer, which is sounds like a silly thing, but it's a big deal.
Yeah. I want to highlight your resource here, your website, healthymen.org. And
Thank you.
Through there, you have your certification for men's health, correct? And tell us a little bit about what that certification is, who it's for, and also who it's not for, because I know I'll just say it's not for clinicians, or you're not teaching folks how to do their own checks and prostate exams.
No.
And things like that.
Yeah, it's very much an educational communication type of a thing. It's called the Certified Men's Health Educator course. And it really is, it's designed for providers and educators and faith-based people and coaches, anybody who deals with men and boys, about how to understand the unique health issues that men and boys have, the ways that men and boys need to be communicated with, because you can't just take a health-related program that's geared for women and change the words a few words here and there and call it a guy program. It's just not going to work. That men need to be approached in different ways. So it's talking about how do you communicate, how do you understand what the issues are, how do you set up and run a well-performing and potentially profitable men's health program in your community? How do you get guys to come in for screenings? So it's about all of that, but it is absolutely, as you mentioned, it's not about how do you do a digital rectal exam, or how do you how do you tell the guy to look left and cough, or whatever those things are. It's not about practical physical hands-on types things. It's much more psychological, and it is a certification program. So we're there's tests to take along the way, but it's been very successful. We've had a lot of people go through it, and have found from the people who have gone through it, more than 100 graduates, who say that they have 90% of them said that they had already begun to use what we taught them in the class, and that it's improved their relationships and their engagement with the men and boys in their practices.
Yeah, you bring in two things now, and there's two things I really want to discuss, because number one, the way everything's being done in health now is being done fast. Everything's fast. Training's fast. It's online. Let's just do this. Let's go here. Let's do this. Let's go here. And you get this. It's really not. I took it 2 minutes to do it. It wasn't really that important. Why do I need to do this? How are you going to engage men to actually get into that flow? Because right now, like I look at, I can bring it into training for you. They've dumbed down the industry. They think that you need to learn how to do something to execute a movement. It's not as easy as getting a book and trying to do something and creating something that might be bad for you, which is not, people don't think it's possible because they're getting it online. So how do you think that with everything that's going on online, how does that affect men in general? And how does that affect the healthcare in terms of being the welcoming of healthcare?
Wow, there's positives and negatives to the whole online thing. I think online, I've talked to a lot of providers who say it's really nice when a patient comes in and he's done a little bit of research and he's got some sense of what's going on and has maybe a little bit of a plan. It's also frustrating when he stopped doing his research on the first results on Google and found some absolutely idiotic thing, and that the solution is apple cider vinegar, or whatever whatever these things are. So you can have both of those. The program that the certified men's health educator thing is something. It's not going to be a 15-minute project. It's going to take you 8 to 10 hours to do it. It's a you're really going to learn some stuff. And I think it's maybe because I'm old, but I think that there's some very important lessons to be learned, and sometimes it takes a little time to learn them. You can't learn everything by watching a video. You have to actually open up a book and learn a couple of things that way. So but then to get back to one of the positives, a lot of guys don't go to the doctor because it's far away, because it's inconvenient, whatever it is. But having telehealth has been a really important addition, that people can say, look, I got this thing on my arm here, doctor, can you help me with it? And in we have to leave it up to the responsibility of the provider to say, that's something I've seen 1,000 of. We can take care of it with a prescription. Or, well, it looks a little weird. You better come in. There is no substitute for hands-on approaches in many cases.
Do you think? I'm sorry.
I was just going to say. I was going to say. I hope that answered your question.
Oh yeah. Do
okay.
The average time a doctor has with a patient is about 4 minutes.
Oh.
So,
is there a question in there?
There's going to be a question. I just don't know what you can get done in 4 minutes. Like, I mean, I used to, when I used to be with my doctor, I knew my doctor intimately. You know what I mean? And we would go back and forth, and I knew my history. That took more than 4 minutes.
Yeah.
Healthcare has progressed itself now to its 4 minutes, X dollars, 4 minutes, ROI, 4 minutes. How many patients can I get through this line? And I don't see any more. And I'm talking about my patients, and I deal with physicians on a regular basis. I don't see the level of care that I used to see.
I think it's impossible.
Go ahead.
How could you possibly provide any sort of decent level of care? And it's tragic, but that's where we are with the insurance company. I've seen this with my parents.
Yeah.
Excuse me. My mom's 90. My dad just died a couple of months ago.
Sorry.
But my mom went to thank you. My mom, both of them were part of this thing called the comprehensive care, that all of a sudden their particular healthcare system in Walnut Creek, California set up. And the appointments with the doctors were an hour. And it was wonderful. And it was very integrated. They had a mental health person, they had a social worker, they had the regular doctor that you saw. And it was just absolutely fantastic. And it lasted about 6 months. And then they closed it because, of course, you can't make any money if you're spending an hour with a patient. It was a great idea. I don't know what they were thinking exactly, but somebody was thinking the right thing, that we need to get back to this. And my parents were never better cared for than when that was going on, as opposed to now their children having to spend, so she gets a 10-minute appointment, and then I have to spend a half an hour yelling at people to try to get them to get the tests ordered and the results ordered and the prescriptions ordered and everything else. And then, it's not a good system.
No, I have a 94-year-old mother who has Alzheimer's, and the processes that I have to go through. Her doctor just shut her down one day, just cut her off. This is a town upstate New York. One day I went to call to get something from the doctor. The doctor says, she's no longer my patient. Well, you didn't tell me. I got her POA. I'm the power of attorney. What does she do? Because she hasn't done anything. She's like, no, I'm not doing that anymore. And all of a sudden, my mother got cut off from her physician, by the physician. So when we're talking, I'm not meaning to talk about my mother, but the whole healthcare maze is impossible. It really, really, really is impossible. I also think that's a reason why a lot of men don't go in also, because it's just a lot. It's a lot.
It's a lot. And I can tell you, I mean, and this is by no means tooting my own horn. And my sisters have been both of them very active in monitoring and managing my mom's care and my dad's care before that. But we were willing to, and we were educated enough to be advocates. And I think so many people, it just makes me feel really sad that so many people don't have advocates. Your mother's got an advocate, and my mother does. But there are people who probably, I mean, this will sound grandiose, I guess, but there are people who die because they don't have an advocate, because somebody is not out there saying, "Wait, hold on just a second. You need to see this person, and you need to see this person today. And I'm going to call you back in 5 minutes and bug you and yell at you if you don't get this stuff done." But not everybody has the capability to do that for themselves, and not everybody has the bench behind them that's going to act as their advocates. But that, in some ways, to kind of loop back to the guys, is I think we're more willing to do that for other people in many ways than for ourselves. Is that we'll spend the time to make sure that our kids get in if they're injured, or that our parents or spouse or whoever else that we're looking out for gets taken care of and gets the resources they need. And then we'll just kind of sit back and say, well, it's only bleeding a little bit, or there's only just a small piece of bone poking out there. I can just get that back in.
Well, I think I'll jump in. I was saying something that to this healthcare kind of doom and gloom is how it's coming across. There's the medicine 2.0. If anyone out there is familiar with Dr. Peter Attia, his recent best-selling book Outlive, he talks about medicine 2.0, and you guys kind of alluded to it as I was listening, of the fact that system is set up to keep you alive. That system is set up to check is there anything that you might die from in this 4-minute visit? And if not, then okay, nothing urgent. We'll see you next year. Like, you're doing okay. We don't expect much from you, and we don't have the resources to give you too many other tools. Medicine 3.0, which he talks about it, and I think this is where podcasts, different resources like the healthymen.org certification. We're talking about medicine 3.0 of it's up to you, the individual. It's no one's coming to save you. The government's not coming to save you. You might, the next pandemic that happens, it sounds like it's coming at some point. Again, not to be too doom and gloom, but what's our best defense is what we saw in this last one is being healthier. Can you as an individual be healthier? You were talking about, to connect it all back to fatherhood. One of these other memes, I don't know if I've just seen it a lot because I do fatherhood stuff online now, is there's the concept of, like, you would do anything for your kids. You would die for your kids. You would dive in front of a bullet for your kids. But will you get healthy for your kids? And will you start working out for your kids? Will you put that cigarette down, like you said, you were talking about? So this medicine 2.0, medicine 3.0, the healthcare system, I don't know that we're going to solve anything, right? I think anyone listening here, that the hope, the best chance we all have is spreading the good information and being the node, being the change that we want to see, that we hear. We hear this problem. We say, hey, it's not really my problem, right? Like, I'm taking care of myself. But if I've gone through the process, like my father died of a heart attack at 41, coming to America, all this, we were immigrants, and then he died of a heart attack at 41. I just turned 40. I'm going to be 41 in December. So what's my likelihood of that happening? I don't know. But I went to, be proactive. And again, you guys alluded to this healthcare system. It was not an easy system to navigate. I had to go to my PCP. I had to go to a specialist in cardiology. Then I said, hey, can I get this, extra testing to see, I've done the research. I want an ApoB test. I want a calcium score. I think I need a CT angiogram to check all these things, that what's going on with my health, what's going on inside of me. There was no transparency in pricing. There was no communication between doctors. And this is one of the better, this is one of the better medical systems. Boulder Community Health, I'd say that they're ranked super high. And, you know, not to compare systems or what have you, but point is that I want to share is I still have to take it upon myself to say, well, what can I do? Do I need to pay cash and go and take care? Do I need to work with a functional medicine practitioner, which I also do? How much is that going to cost? All these things are scary. You know, am I going to end up incurring $10,000 a year in medical costs just to be proactive? You know, it's a scary thing. So my ultimate thing, though, is I'm still going to come back to eating healthy, working out, doing what I can. If Armin, if you didn't catch the beginning where Corona is talking about our sponsor of the show, Fit Care, Wellness and Physiotherapy, that's my company. My whole system is if you focus on your fitness, and we're talking about vital signs, the same way when you go to your doctor, they might look at your cholesterol, your blood pressure, things like that. But we don't look at our physical vital signs of how well can you sit on the floor and get back up. And if that's not looking too good when you're 55, we're going to have problems 10 years from now. Go ahead, Dave.
But you're and I say this with all respect to you, you're an educated person. How many people really actually know
that's what
you just
that's what I'm saying.
I know
It's on me to pass that information along. That's why we're here.
I understand, but we have been dealing with CEOs, and I think Armin can jump in with this. We deal with people who first of all, money doesn't guarantee you anything. I don't care who the doctor is. The doctor could charge a lot of money. That doesn't guarantee you good health. It just doesn't. You have to be responsible for yourself. But what you're discussing, Bo, is many years of you studying, many years of you understanding stuff. And then when you add it on, because Armin's has been doing this work a lot longer than we have. I deal with people on an individual basis in my practice. But when it's all said and done, people stop on that first Google page. There's a lot of people, they come down to, that's it. A WebMD said X, so I have cancer. So if you go on the WebMD, you have cancer. I mean, it's just what we're looking at. It's a very, very, very interesting way to kind of try to navigate this whole system. Go ahead, Armin.
No, I was going to say, this gets back to your question earlier about the pluses and minuses of technology and social media and things like that. What it comes down to, I think that Bo's right, that it's up to us ultimately to take the steps. That we live in this fast world where you kind of think there's a pill for everything and there's a quick solution to everything. And if you do 3 things, you'll be fit. It's not. I mean, I remember you probably have seen this a lot more than I have, but I remember when the Insanity workouts came out and when PX90 came out. And I remember watching some of the infomercials and thinking, wow, this is honest. They're actually saying if you will work out for an hour a day, 6 days a week, you will have some results. And instead of the ones that had come on immediately before that saying, if you put this belt on and put the batteries in, you will have the equivalent of 10,000 sit-ups in 15 minutes while you're watching TV, and you can eat, are you out of your minds? You're going to have to do it yourself. There's no excuse for it. So,
well, hold on, Armin. Hold on. I don't know if you know about this whole Ozempic thing, because I can take a pill. And
yeah, but then you get saggy.
I'm being facetious just for
you
anyone
get saggy skin. You get saggy skin from that too.
There seem to be all sorts of negative side effects to Ozempic. I was being my usual facetious self, just to be clear. It is a conversation we've had on a lot of other episodes. But go ahead.
Yeah, no, I mean, that's just, I was wrapping up there. It just, ultimately, we need to have direction from professionals such as yourselves. We need to have experts who are out there telling us stuff. But we actually, we can't just imagine that it's going to take care of itself. We're going to have to do the exercises. We're going to have to take the medication if we need the medication. We're going to have to change our diet. It's not something that somebody else can do for you.
And I think, even in this Ozempic conversation, joking piece to that is I think, and something that we were talking about on our other recording there is the fact that I think the information is hard to simplify. You asked me a question at the end of our, you even said it after I went into a whole scientific expansion and my tangents. And you said, well, so what is it, Bo? Should I be doing ballistic stretching or static stretching or before or after? I don't know what to do. And I'm not, not trying to make you feel bad for that question, but the point being that, there's no simple answers. It's a complicated thing. And even if you go online, okay, what did Joe Rogan say? That now becomes like, the bro code of it all. Bro science is a whole thing of, of you go, and if you're in the gym, you're talking to the guys who look big and maybe they know what they're talking about. Okay, I'm going to start eating protein and carrying around with Tupperware or whatever. And there's some validity to that. There's the pseudoscience of it all. And then there's this huge gap of what does the actual science say, or what do people like me who, I say I spent over $500,000 in understanding how the human body works, at least. and I continue to spend more. I just bought a diagnostic ultrasound machine. I hope everyone's excited to see what I do with that thing. But the point is, to come back to it, is I think you mentioned the Obama administration was trying to push men's health as well. Women's health. Sorry.
Women's health.
And Dr. Vivek, I forget. I don't want to mess up his last name. Not Murphy at all. No, it's a very Indian name. Dr. Vivek is Mushwami. We don't want to mess it up too badly.
I met him once. He's a nice guy.
Yeah, so he was the Surgeon General under the Obama administration. I believe he returned for the Biden administration as well.
He did.
But he brought up the whole concept. It kind of, I'd be curious if there was any connections into your men's health piece of the concept of loneliness, and how connection is really something that in this digital age of being exposed to everything, we've actually lost a lot of this human connection. It sounds like there's some tie-ins to what you talk about. So I'd love to hear that.
And before you answer, Armin, Scott Galloway has been on the professor from Stern at NYU has been on this kick with this loneliness and men having the lack of connectivity with other men. Right. And as we get older, we are like, I have a good amount of friends around me, dear friends I could talk to about anything. That's not normal with at least me at 55, 56. I don't see that a lot around me from other guys, but I do see that. But this whole loneliness thing and this whole thing with online and being online and scrolling and looking at other people's lives, we're not really connected, which brings us right to this mental health piece with men, which is huge. I mean, it's huge. You're seeing kids shooting kids. There was one today where kids are just, they're in these chat rooms or whatever you want to call them, and they're getting reprogrammed. It's a wild world we're living. It's really, really wild.
Well, the mental health thing is huge, and loneliness is certainly a part of it. And Dr. Vivek Ramaswamy, I think, is what it was. Something
that sounds
like
right.
That
sounds right.
He was saying that it's basically the same as, I think, smoking a pack of cigarettes a day or something. Yeah. It's bad. It's bad for you, and it tends to be more of a guy thing. Is that we have fewer friends, particularly as we age. We tend to want to do a lot of stuff on our own. But you see this, and this is one of the things that gets me really fired up about this men's health stuff, is that 80% of suicides are male.
Yes.
And if that isn't a mental health thing, I don't know what is. And imagine if all of a sudden somehow things were reversed and we said 80% of suicides are female, we would know what to do. There would be a public health crisis, and we would do something about that. And it gets worse with age when it's into the guys over 65 or over 70. The suicide rate is something like 10-1 males to females. Wow. It's just shocking. And if you look at the drug overdoses and what they call the diseases of despair, where you end up with drug overdoses and alcohol related things, there's 75 to 80% of those are males. And so we've got some mental health issues that are not being addressed. And part of it is actually participated in a really interesting study on this. We had a series of webinars that we did. We had some in-person meetings talking about this with experts, that a lot of the screenings that are used, the mental health screenings to catch depression and anxiety, are designed to catch those symptoms or to identify symptoms in women. They say things like, do you have feelings of worthlessness? Do you cry very often? Well, most guys are not going to say that they cry very often. And most guys don't think of themselves as being worthless. They just think they need to get another job, or they need to have another couple of beers after work to help them gut through whatever it is. And so what happens with the guys is they get shunted off to anger management instead of to talk to somebody about anxiety and depression, which is what they really need. And we end up with a bunch of guys who continue to commit suicide, which is just really, really absolutely awful. And it's part of our system. When you get back to the 4-minute doctor visit, you can't do any kind of a mental health screening on somebody who comes in. I mean, particularly somebody who comes in and his erection issues might very well be the result of anxiety or depression. It's entirely possible. But if you haven't even gotten past how you doing, Bob, and he says, well, I'm a little creaky here in the mornings, and then, well, see you next time. It's a wasted 4 minutes. You might as well have skipped that and gone to the next patient.
Let me ask you a question. In your studies, how many guys are open when they go talk to the doctor?
Not very many. Yeah, I don't know percentage wise, but I mean, it's a combination of the guys do not answer, are not ready to answer the questions partly because they don't have a relationship with the provider. They don't feel comfortable talking to him. If you've got a relationship, and it doesn't, we talk about the doctor, but it's not necessarily a doctor. It could be a physician assistant, could be a nurse practitioner, could be any kind of a provider, could be the pharmacist. But if you know the person and you've been able to spend more than 4 minutes with them, you're going to feel more comfortable saying, well, I'm having this problem here. I'm getting up 5 times a night to pee, and I haven't slept through the night for years. And then say, well, let's talk about that. Let's order some tests. You need to have we'll take advantage of Bo's new ultrasound. We need to get you an ultrasound of your bladder and see what's going on. So it's the guys don't know the questions. The providers either don't have time, or a combination, don't have time or the training to ask the right questions. And so what happens is these guys, well, that was a waste of time. I'm not going to go back and see a provider again for the next couple of years unless something's really happening.
You said something interesting. Oh, go ahead. So go ahead, Bill.
Wait, I said something interesting.
Go talk about the interesting.
Oh no. It's such a rare.
No. I just know that what I found interesting is you said that the doctor didn't have the skills necessary to have that conversation, which you don't hear very often.
Well, it's a sad truth, and I can say this as a non-doctor, but there is, in almost every medical school and nursing school program, there are units and semester-long courses on women's health. And how do you talk to women? How do you approach women? What are the health issues that women face, and how should you be dealing with them? How should you be asking questions about them? There is, in exactly 0 medical schools and nursing programs, any significant content on men's health. So, and there's the obstetric and gynecologic people. They focus on that. Well, there is a urologist, and urologists tend to be the kind of equivalent, except for they aren't the primary care physicians for most people. And I've talked to a number of them. A lot of them say that sounds ridiculous, but the majority of the calls they get to their office are from women saying, my husband, he's I went in the bathroom and there's blood in the urine. What the hell is going on? Get him in there. And so women are it's like men's health has become a women's issue, which sounds silly, but it's super important, which is why a lot of the stuff that I do has to do with talking to women about men's health and what they need to know about men's health, because unfortunately, we were talking about this before. It's not going to happen in my generation or my kids' generation. We want guys to be able to take care of themselves, but in the meantime, we have to educate everybody else so that they can help us along.
And that's kind of what I was alluding to, of the fact that we need to start, I think, sharing and continue to really amplify these concepts of what things do men especially need. And I don't know if you have this in your certifications. Like you said, you're not doing necessarily testicle checks and self-prostate screenings. So Corona, stop it. But the point, but in all seriousness, what things should we be looking out for? Again, it's not normal to get up and pee this many times a night. It's not normal to be any kind of blood leaving outside of your main organs. These are things that should be, almost seem silly to talk about. But that's where, again, we talked about what do physical therapists do. Physical therapists can help with some of these basic educational components. I think it's missing in our profession as well. Not every provider is going to give these next level things. I try to do it as much as I can. And I'll admit, I give a lot more information to women especially from an orthopedic standpoint. When a woman comes in with hip pain or back pain, I say, has anyone looked at your pelvic floor? I'm not going to do that. But that's something. It's not normal. We have a screening, a kind of standardized screening for Do you have problems peeing? Do you have painful sex? That kind of thing. And again, as a 40-year-old male, giving that to a 60-year-old woman, not every woman appreciates that. But at the same time, I'm like, hey, if I get in trouble for this, or if the woman does not appreciate it, like I hope that does not become a problem. But the same thing for men, again, where you have to kind of battle with the egos, battle with whatever that is of restriction, hesitation, static of that dynamic. And again, a lot of medical providers are not going to take this time. So that's where I come back to on social media. We need to start, I think, filtering out and calling out a lot of the BS. Again, doing ice baths. You mentioned apple cider vinegar. Doing these kind of magical things is not going to cure a lot of people's problems. We need to come back to how long can you stand on one leg? This is my big push. I think that this next year is, what are these vital signs for movement? We can, again, get some sense of blood pressure, get some sense of cholesterol. And that's a huge debate of, do we need better HDL? Do we need less LDL? Should we be on a statin? Again, that's that medicine 2.0 versus medicine 3.0 conversation. But yeah, I'll come back to simplify the concept of, I think, again, I'm challenging myself to do better here. And again, I appreciate you being on, Armin. I want to be respectful of your time, the listeners' time. And I'll just share Shane McLean, one of our former guests here, also mentioned that there's a dog park skit on Saturday Night Live, a funny spin on this serious topic. If anyone wants to check that out, I'm sure we can link that in the show notes. And he also added that he's glad we're talking about this serious topic. But to finish off that concept, again, outside of your healthymen.org, any resources you want to share with us of where folks can start, improving their educational levels and making a change in their own lives?
Well, I really think that things like CDC and the Mayo Clinic, I mean, I think that they are good sources of professional, medical, vetted information. And it's really important to as we've been talking about, to take charge of this thing and start doing some research. If you're a Black man in particular, you need to be looking at what risk factors are.
Armin, your audio is doing that thing again.
I'm sorry. You still there?
Yep,
you're good.
Better.
Okay. Sorry, I may have just leaned away. But you need to know what your risk factors are. You need to think about your family health, do a family history, and also just take a look at the CDC and Mayo Clinic sites for racial differences. That Black men's health outcomes are far worse for most things than white men. Asian men seem to be a little bit better. Hispanic men and Native American men are the worst of all. But if you have a history of any kind of health issues in your family, you need to take those things a little bit more seriously for yourself. That just raises your risk. And if you're an older guy, if you're over 55 or 60, you start thinking about the flu season, and get yourself a pneumonia shot and a flu shot and the coronavirus shots as well, because those are lung issues. And if you've got asthma, you're at risk, and you need, but it's the kind of stuff that we as we've been talking about, you need to do the research yourself somewhat. Your doctor's not going to be able to get to all that in 4 minutes. So you need to figure out what your risk factors are and what you can do to minimize your likelihood of dropping dead from something you don't need to drop dead from.
Yeah, I know we're trying to, manage your time here, but you brought something up, and it touches me because I'm Cuban, I'm Latino. The medical care for people of color and the men of color in comparison to Caucasian men is completely different. In terms of the medical care you get, and you have to be, and I'm going to say this, you have to be more proactive when you're coming from that angle, I would assume, because you're not getting the same level of care. Do you see that regularly? I know it's a fact because I happen to be a person of color, but my question is, is it like rampant all over the place, or is it just, I guess, is it rampant is my question.
Well, it's common. I wouldn't say rampant necessarily. And I guess I'm hesitant to attribute any negative or systemic racism kind of thing to it. I think that a lot of it has to do with, for example, just because of the nature of minorities, there are not a lot of minority providers. And that makes it harder, right? If there isn't, and there's not a lot of, also, as I mentioned, there's not a lot of men's health content and training in medical schools, there's also not a lot of cultural competence training in medical schools. And so there's no reason why a white provider shouldn't be able to provide a black man or an Asian woman or anybody else. They need to understand the differences. And that at the very least, in the absence of having a Cuban provider for you, which may be hard. There just are not a lot of Cuban medical providers or not a lot of black doctors. And so when people want to go in to see a provider who looks like them, which is a perfectly reasonable thing, but it's not always available, we could do a lot better by having the medical schools and nursing programs do better recruiting jobs, and by having the medical schools themselves do better recruiting jobs and have better training for people. Not necessarily as doctors or nurses, but as physician assistants, and that kind of thing. But it's partly driven by a number of different things. It's driven by a mistrust in the medical system. So you have a lot of minority people who don't go because they already think that the medical system isn't going to take care of them, which is a problem. And then you've got the lack of people who look like me problem. In the black community, it's a big deal. There's a lot of people who say, well, I don't know, I don't want to go into that hospital because people don't come out of there alive, which is a common thing. And, you look at black men's life expectancy, they barely live long enough to collect Social Security. We've got some problems here.
Let me ask you another question, because the more we talk, the more interested I become. Food.
Maybe we should hold off for a part 2.
Yeah. Okay, we could, but I got to have this here.
Go with this one.
Food.
All right.
Food. Because I believe our food that we eat, for the most part, is poisonous, and a lot of things that we're ingesting aren't good for us.
Yeah.
Does that play?
We as a culture, who's we? Americans?
I'm talking about the American foods. The way you go to Europe, it's a different
standard
ballgame.
American diet.
It's different. Listen, my girlfriend just got back from Paris the other day, and she had
went
great
without
food.
you? She went without you. I think we need to.
She wanted to have a good time.
I was gonna. We need to.
She wanted to have a good time.
More.
That's why she left me at home. But how does the food play? Because our diets are different, and what we're ingesting in this country, they're putting things into our food that I don't believe should even be there.
Well, there's that, and then there's also, again, there's some cultural differences. That in the black community, they're eating a lot of really unhealthy stuff. A lot of really high-fat meats, and I don't know much about Cuban cuisine, but
it's delicious. We need to get you.
I'm sure it's delicious, but is it because it's fat? It's because of the fat and salt that it's delicious, or is it delicious for some other reasons? But so it's part of it is the cultural stuff that we need to address. And the black community, I know I've been to a number of black health fairs, and they talk about this. Is that we're after church we go and have fried chicken, and we have. All this stuff that people should not be eating a lot of, but we do.
No, it's crazy. Go ahead, Bo.
No, I think we do need to wrap it up a little bit, be respectful. We started doing that about 15 minutes ago, but David kept asking questions. I'm not gonna throw you under the bus or anything, but
you can throw me under the bus. I'm just interested, and I think our listeners are probably just as interested as I am.
I think we could keep talking with Armin for a few hours for sure. We'd love to have you back. Yeah, we'd love to have you back for another one. I know I'll never be invited back to his show, so it's after what I said on his show teaser. Spoiler.
You got to answer questions. No, it's
guilty as charged. Guilty as charged.
No, you were answering the questions in a great way, but it's like ultimately. People say, "What? What do I do? What do I do?"
I know.
So it's You
got to tune into You got to buy my exclusive Dr. Bo program. That's the only way you can get all the answers.
Oh, all right.
3 easy payments of $19.99.
You're a mess. Armin, I'm going to first of all, I'm going to say thank you. A huge thanks to you for sharing your incredible experience and insights on the topic that isn't often talked about. We truly appreciate you. Be sure to check Armin's work at, where do they check you out at?
Healthymen.org is the health stuff, and also mrdad.com for fatherhood stuff, mrdad.com.
We didn't have a chance to get to the fatherhood.
Prolific.
We didn't get a
Yeah, I
chance
don't
to
know how
get
to
the
do anything else. I just sit. I sit and write. Yeah, well, the next time we'll talk about fatherhood stuff.
We're talking about fatherhood. Go ahead, Bo.
I was gonna say
You know I'm trying to close, right? I'm trying to do a close for you.
I just want to put that little cherry on top. Over 500 public appearances on nationwide. Was it the 500 on nationwide broadcasts and things like that?
I
Just
stopped.
prolific.
I mean,
I didn't see how many books you wrote.
At some point.
Yeah, I was gonna say. I mean, he's got books on all over the place. For every and I actually just downloaded. I have a toddler, so I downloaded the audiobook for Armin's Guide to Fatherhood for a Toddler. So, and I'm excited to check out the rest of the catalog. And so far, I've only listened to about 20 minutes, but it's been excellent. It's been an excellent 20 minutes.
Don't listen in the car.
Can I close now?
Yes, please.
All right.
Remember, your engagement is what keeps us going. Leave a review, share this episode, subscribe, and most importantly, act. Demand better for your health, fitness, and future. We are sponsored by Fit Care Physiotherapy and Wellness, where the emphasis is to focus on your fitness so you can avoid the healthcare space. We'll be back soon with more inspiring guests. And until then, keep demanding better. And we're bringing Armin back. I'm just telling you. See you guys later.